Petit chocolat. Et ça...
Gamba Ouais, ok.
On se connaît, Rachel.
Oui.
On s'était déjà rencontrés 2 fois, non?
Oui, 2 fois.
Ouais.
Il y a longtemps.
Mais vous n'avez pas encore mis ça ici, Kamba Moja.
Ah. Donc, voilà.
Kamba Moja are with Rachel. She is responsible of Kamba Moja. Can you explain to us what is Kamba Moja?
Kamba Moja is common threads. It's an approach, a unique approach for deep, transformative psychological recovery from trauma. So the women, one of the things that the women do, which is a widespread cultural practice, is they sew into cloth that which they cannot say.
Mm-hmm.
So they are able to tell their stories in art, in sewing, which allows them to process slowly what they have experienced. It is deeply self-regulating, so they can stay grounded and calm while they are thinking of and exploring very emotionally charged experiences. And that's the basis of the therapy.
Yeah. You started this therapy 6 months ago here at Panzi. And what is the result after 6 months?
So the women have done an amazing job in reducing the symptoms of the trauma, which is just a beginning. So depression, insomnia, flashbacks, all kinds of mental health symptoms that they had very strongly have reduced markedly. And for many, they're telling me they no longer suffer these symptoms at all. But beyond that, see, I think that's only the beginning. That's not enough.
Yeah.
What they do is find solidarity and community with each other. They discover that they're not alone. They overcome stigma and shame and self-blame and guilt and loss and strengthen their coping capacities for the future. And now what they're doing, which is the final stage, we have several stages of the work, but now they begin to really experience their own power to change things, to fight injustice. And that for me is part of the recovery process.
Of course, when women start to fight for the right, it's really the way to show that they're going through healing process. But how can we evaluate this therapy?
I'm glad you asked, because that's exactly what's being done now at Panzi Foundation. We have now in progress an evaluation that will be a small pilot evaluation of this project to understand whether it's working and how it's working. We're interviewing participants and the facilitators, the psychologists themselves, and we're beginning to, I think we will see some very, very strong results. What we would like to do is the next step, to do serious,
it was my next question.
serious, rigorous scientific research is what we would like to do next. We want to scale up the project. This was pilot, and we would like to expand the project and now do really thorough, rigorous research that will be mixed method study of both quantitative and qualitative measures.
Good. I think that this is really what we need to do, because on my perspective, it's really good if we can get some evidence on the therapy that we are doing at Panzi.
We must have evidence.
We can scale it to other centers, and we can't scale something that just we have opinion on what we are doing.
Exactly.
Thank you, Rachel, for what you are doing.
Thank you, Dr. Mukwege. It's my honor.